This episode of Spotlight Hawaii is brought to you by Chaminade University.
Well, aloha and good morning. Thanks so much for starting off the week with us. I'm Ryan Kalei-Suji, joined by Yenju Denise, and this is the Spotlight Hawaii on the platforms of the Honolulu Star-Advertiser. And today, as the state continues to grapple with the COVID-19 pandemic, we're seeing those case numbers rising. But more alarming, we're seeing the impact that it's having on our hospitals. And today, that's the focus of our conversation, Yenji.
Yeah, this is so important because whether or not you are vaccinated, whether or not you test positive for COVID-19, we all rely on our hospital system. And right now, our hospitals are facing great challenges. So to join us, we invited Elena Cabatu of Hilo Medical Center, along with Jason Chang of the Queens Medical Center. We really appreciate you both being with us here this morning. Jason, I want to start with you. Where are we on ICU capacity, and what kind of strain is the healthcare system under right now?
Over the last few days, we've increasingly watched our beds get filled up with COVID patients. I have 93 at Punch Bowl, and across the entire system, I have 113 COVID patients we're caring for. Our ICU beds are completely full, and it's not just COVID. These are other patients, so some of the traumas and the STEMIs and the heart attacks and stroke patients, and people are just sicker for some reason, and we're not quite sure why. But it's creating a competing priority for our ICU beds. I think that's the biggest issue that we have today, is that of all the ICU beds that we have within our system, all of them are full.
And what, if you can explain what's happening over there in Hilo, Elena?
Yes. So in Hilo, we have 18 COVID positive patients. 3 are in the ICU and 15 are in the medical unit, which is now the COVID unit, 16-bed COVID unit there. In our ICU, we also have 3 long haulers, and one of the 3 have been with us for about 50 days and counting. So as you can, if you add it up, we have 6 people in our 11-bed ICU that have been affected by COVID, and we are very full.
Well, tell us, Elena, let's start with you. When, on a practical level, someone has a heart attack, someone's in a car accident, your ICU beds are all full. That person needs urgent medical care. What then happens?
What happens when and if we have a heart attack that comes in or a car accident is that we hold them in our emergency department and we float some ICU nurse personnel down to the emergency department. And it is not our preferred way to care for critical patients, but it's what we have to do when our ICU is full.
And Jason, for you, we know that the Queens Medical Center, of course, is the trauma unit where many patients from the Big Island, neighbor islands often get medevac too. During this time, with your capacity already limited, what are you dealing with terms with some of these trauma patients that could potentially be coming in?
We are doing everything we can. We never go on trauma diversion, and we never go on stroke diversion. So if you ever get into an accident, you are able to get to Punch Bowl. We do a great job. Our staff, our physicians are really accommodating in creative ways to make sure that there's access to care and you have the best care that you would expect, regardless of the situation going on. But it has been more difficult. We're helping hospitals on neighbor islands and here locally manage patients that are within your wheelhouse that you traditionally would have put on a plane and shipped over. I think that it's going to have to take a lot of communication on a daily basis, looking at what's the census look like, what's our capacity look like, and what are the capabilities for the various hospitals to manage the patients that may be taken care of in those hospitals. The challenge is that other hospitals are extremely full at this time too. You heard Elena talk about what's happening in Hilo, and that's not uncommon to the other hospitals around the state. So as their capacity fills up, we're really looking at a crunch. And so we're asking for people to be, extra safe, not just because of COVID, but really trying to balance the entire health system.
I mean, that's a challenge when you tell people to be extra safe. Obviously, we try to be like that every day, but you can't help it if you have a heart attack or if you happen to get into a car accident. There's a question here from Heidi. She says, let me just bring this up. She says, can you speak about the need to divert patients to other locations? Now, I know that you said that if you make it to Queens that you don't get diverted somewhere else, but you want people to sort of be able to go to other hospitals. So can you answer Heidi's question as to what that actually looks like on the ground?
Sure. So we do have to go on diversion. It does happen, and we try not to, but when the emergency department has so many patients that there's literally nowhere to put a patient, and we've exhausted things like hallway beds, it gets really challenging. And so we go on diversion, which is ultimately a function of letting EMS know that there's not a place to take one of the low acuity patients, and they need to go to the next nearest hospital. Again, trauma and stroke still come to Queens regardless, and we'll figure that part out. But we do. There was a situation last week on Monday that we had 50 patients in our emergency department waiting for a room overnight. So we had to go on diversion the better part of that next day. And what we do see is that when we go on diversion here at Punch Bowl, many of the other hospitals quickly go on diversion too, because they don't have the capacity to care for high acuity and high volume. So it does have a trickle down effect on the entire healthcare system.
And what is the situation like on the Big Island with the diversion of those patients? Going back to that comment by Kala, who was asking about, thanking you're actually here for the work that you're doing. But Heidi also asking about the need to divert to different locations. What are we seeing there on the Big Island? Because we know that this is something, obviously, that with the limited resources that are there.
The Hilo Medical Center is the largest hospital on the Big Island. The only real acute care hospital on the east side. So we have no option to divert. We are the larger center that gets fed patients from other hospitals like Ka'u, like Honoka, and even North Hawaii in some cases. So we don't divert. We have to we do our very best to care for the patients on our island, and if we need to, and if it is required of the patient, then we will work with Queens, with other specialty hospitals on the other islands to transfer the patient very safely.
It looks, Yanji's.
Once a show. Jason, I want to ask you, we've heard a lot about the 500 plus healthcare workers that are coming to the islands, travel nurses and what have you. What kind of a difference is that going to make, and will that be enough to take care of the needs of our community?
Yeah, that's a great question. And I think the biggest thing is that staffing is our biggest concern at this point. We have some blocked beds, and we're blocked because we don't have enough staff. Acuity is extremely high, and despite the fact that we've added over 110 nurses over the past year, we're still really stretched. And so the 500 nurses, I think Queens is slated to get 130 of those, is a welcomed relief. One, it'll allow some of our frontline caregivers who have been working double shifts to get some rest and have time off and rejuvenate. But then beyond that, it allows us to open up some of the beds that we've had blocked. So we can't wait for them to get here. The 23rd can't get here fast enough.
I want to bring in another question here. This one from Stephanie, who's asking, are there any plans to set up auxiliary facilities or beds at Hilo? Can you talk about the plans to expand capacity at Hilo Medical Center?
Yes, so we've looked at our plans throughout the last 3 weeks or so as we saw this surge come into play, and we also had higher acuity patients. We do have an acute care module, which is one of those big tents that we can put patients in there. We also been working with the county to identify a location in which we can set up an alternate care facility, so we can figure out what types of patients should go in that kind of either ACM, the tent, or the acute alternate care facility. And then we have to figure out how to staff that. So very similar issues to that of Queens, with staffing that's stretched. The higher acuity of patients are really putting a huge strain on our staff.
Yeah, and I want to stick with you for just a second there and ask you about the long haulers that you mentioned. That, when you have a patient in the system for that long, what kind of an impact is that having?
Well, that has an impact on our system, in which having someone in the ICU for 50 days means that bed has been taken up for that long of a time in the ICU. Generally speaking, in the ICU, we want to get those patients better and then downgrade them to other locations in the hospital. The other long hauler that we have here made 100 days with us in another part of the hospital, the medical unit. And that too is another location in which we could have downgraded a patient into that bed. So we are holding on to these patients, taking very good care of them. But, you know, it's a matter of these beds being held and taken up by mainly unvaccinated COVID patients.
We seem to be having some problems, unfortunately, with Jason's feed, and we unfortunately keep getting him bounced up. But we'll try to bring him back in as soon as we can. But wanted to just expand upon that a little bit more on those long haul patients, because they are taking obviously a longer time to recover, and there is that whole process that goes into play. What does that then mean for the patients that are coming in now? I mean, because essentially, if the COVID patients that you are seeing now also become these long haulers, I mean, you could have people in these beds for another 100 days, so to speak. I mean, what's the contingency plan, I guess, in those situations if all the patients end up becoming more of these long haulers?
Well, we received some good news because long haulers are actually what we call waitlisted patients, and we have about 30 of them who are non-COVID waitlisted patients that stay in the hospital. They're ready to leave the hospital, but we have no place to discharge them to because long-term care facilities are closed and their admissions are put on pause, or these patients simply cannot go home and be cared for by their loved ones. So that's part of the logjam, if you will, that bottleneck that we have at the hospital, in which if we moved out those patients to their appropriate level of care, then we would have a little bit better of a bed capacity. But because we are experiencing pauses on admission in our long-term care facilities, we are having issues with that throughput. The good news is that we are expecting a couple of the facilities to come back online and start to accept new admissions, and that's going to help us out tremendously. But long haulers being with us for, between 50 and 100 days is quite a while. The average COVID patient that stays with us is with us for about 4 weeks, as opposed to the average non-COVID related patient stays with us for 4 days. So with a hospital as busy as ours, we really need that patient flow, patient throughput to be working. And at this point, it is not working as best as it should be.
Jason, can you tell us a little bit about the profile of who's coming in? Are they staying as long as what they're seeing in Hilo? And also, we've heard a lot about that the majority of these patients are unvaccinated and tend to be younger. Can you tell us who is ending up in those ICU beds right now?
Yeah, good question. So of all the patients that are admitted, I have 10 that are vaccinated. And so the majority are unvaccinated. Traditional length of stay for COVID patients is about 14 days, maybe a little longer than that. Those that are in the ICU tend to stay a lot longer. If you're on a ventilator or high flow oxygen, you're probably going to be in for at least 25 days. So much longer length of stay. Patients are very sick. Right now, when you do recover, it's just a slow recovery. And that's part of the challenge, is they take up a lot of just resources. I think the other makeup is that the patients are younger. The first wave, it was mostly Kapuna, and now we're seeing the average age right around 40. So kind of scary when you think about the demographic. It's people that would traditionally connect themselves with a healthier demographic. And then when they find themselves in the hospital or intubated or in the ICU, I think it's quite shocking to their family and everyone else around them.
We have also heard that there may be a need to put a hold on some of these elective procedures. Jason, at what point is Queens looking at that? I mean, when do you anticipate that may need to happen with the numbers that we're seeing?
Yeah, we are already there. So most of our elective cases started getting canceled last week. We've even taken some more drastic measures and taken sort of a bigger chunk of those elective cases. So now these are not just the emergents that are going, but these are ones that maybe can wait a week. But what we're trying to balance, and our surgeons really are trying to make that right decision between, are there going to be long-lasting effects if we delay this surgery 1 week or 2 weeks? And we know that we need the bed now, we need the resources today. I think the part that makes it really difficult is that we don't foresee this surge to stop anytime soon. So In 2 weeks, the situation actually may be worse. And so balancing those that need a surgery very soon, delaying it and not causing any permanent damage or permanent effects. It's a tough place to be.
And Elena, same question for you. Have you stopped elective procedures there, and how are they making those decisions at your facility?
Again, we look at all the cases week by week, and we are not quite there yet. We can still handle what is coming into us. And so when we get there, we will communicate with our patients and make sure, they're being safely rescheduled, if you will.
Jason, I want to come back to you here and talk a little bit more about testing. We know that there is obviously the need of the hospitals to take care of those patients who are battling through COVID, but there's also a community need for testing. What are you seeing in terms of that numbers, and is Queens able to provide the care to not only service these COVID patients, but also test those that are wanting to get tested?
Yeah, I think testing is a huge part of it, especially, for peace of mind for family members and those that feel like they may have been exposed. We are able to keep up with the testing. We've got multiple channels. First one is Island Urgent Care has almost doubled its volume. So really focused on testing and those that are walking through the doors wanting to get a definitive test. The other is diagnostic labs. They have been continuously providing testing at various venues. So some of them are their regular locations out around the community, but others are strategically working with community partners to provide testing. And then, of course, to the emergency departments as well. It right now does not look like we have any shortage of test swabs, not like we did a year ago. And so we encourage people that if you feel like you have been exposed, you feel like you need that peace of mind, please get tested.
Jason, I want to stick with you and building on something that you said. You said that in a couple weeks, we could be in the same place or even worse. What is the sort of forecast, if you will? And I know it's very hard to predict what will happen, but what are you bracing for, like in the next 2 to 4 weeks, let's say?
Yeah, the scary part is that this is really correlated to the number of new cases per day. And so if we say 4% of all new cases are going to end up with a hospitalization need, then every day that we see the number come out and it's higher than the previous day or higher than the 7-day rolling average, then we know that the impact to the hospitals is going to continue to go up. There's typically a 7 to 10 day lag. So it takes a few days for people to experience COVID and then get sick and then realize that they can't breathe and they need advanced care. And so then they come into the emergency room. So typically when we see these days where there's 700, 800 cases, we know that it's not really going to impact us until next week or the week after that. And so when we talk about bracing for the future and really asking people to be socially responsible and help us get the numbers down, it's a function of that very metric that 4% of the new cases are going to need hospitalization.
Elena, I want to ask you a little more about the vaccination versus non-vaccinated patients that you're seeing. I mean, when you look at the numbers of Hilo and the percentage in the community that represent, about 70% of the population there is actually vaccinated. So they're doing a good job of getting it out there, but yet there seems to be, this large number of patients who are contracting COVID-19. What are you seeing about the profile of those on the Big Island community and on that side of the island?
Well, very similar to Queens. They are ranging from between 20 and 50 years old. And these are head of households. They are affecting also the rest of the vaccination rates in their households. So, but if you look at the map, the larger map outside of Hilo, you will see that there are areas in which their vaccination rates are 30 to 45%, and they're just not where they need to be. And so we are seeing patients from those areas come into our hospital and are hospitalized.
And sticking with you for a second, Lynn has a question here. She says, is there any effect on other services like giving birth? We know that at the height of the pandemic, at some points, partners were not even allowed into the birthing facilities. What kind of impacts are you seeing across other portions of the hospital?
Well, OB, actually, I got a report today that we had transferred some of our medical patients onto the OB unit. So the nurses there are taking care of medical patients, where usually we take care of moms and babies and families. we have not had any impact on our ability to deliver babies. As far as having the birthing partner in there with the birthing mom, we still allow that, and we have not restricted any of that at this point.
And Jason, what about for you? Has there been any adjustment for to those other departments of the hospital, like the birthing department at Queens?
Yeah, so we've definitely gone to vaccinated visitors only. We've also made some adjustments to the triage tent that's sitting out in the parking lot of the emergency department. It's really meant for triaging. So patients that feel like they have COVID and symptoms, we want to test them there, and then we will determine, whether they can be mixed in with the general population. It's not a swabbing station, so we're asking the public not just to stop and ask to get tested, really for those that are symptomatic. And then we're switching our clinics to mostly telemedicine. So virtual health was something that we saw grow exponentially during the first round of COVID, and we are asking people to be cautious. We don't want waiting rooms full of people, and are trying to convert that way. We're also looking at our incubation units. I now have 7 units that have been converted to COVID units. So things that used to be used for traditional, let's say it's a trauma unit or a different type of medical specialty, all have been turned into COVID units. And so we'll continue to shift, and that's what we did last time, is the volume went up or the numbers of COVID patients went up, then we would transition the next unit. So we're prepared for the next one, both in the ICU and for the medical surgical patients.
Jason, there was a question earlier. Someone was asking if there's a difference in outcomes between those who test positive for COVID and have been vaccinated versus unvaccinated. You were saying that roughly 14 days for someone who ends up in your facility. Do you see a difference in how quickly people are able to recover even once they get to the hospital?
Yeah, the one interesting thing is that the vaccination works. It helps your body fight the disease. So you may get infected. It's about 5% or 7% of the population that are vaccinated could catch COVID, but your body's able to fight it off. And the one thing you see is that most patients don't end up in the hospital. Those that are in the hospital tend to have comorbid conditions. So many of them are larger, they have diabetes, they were smokers. And so kind of the same thing that we saw a year ago, those that were the sickest are seeing the worst outcomes. But if you get vaccinated, your body fights the disease much more effectively and almost prevents you from coming to the hospital.
As we wrap up this conversation here, I wanted to just ask both of you just what the morale is, obviously, with the staff that works in both of your facilities and under the management that you folks have at both of these health organizations. You look at this long process that all of these workers and you folks included have been through with the start of the pandemic to where we are now, and seeing this next surge that is really taking over our community. Hopefully we'll get Jason back here, but wanted to ask, how is this impacting over? I mean, the nurses have got to be somewhat tired here. I mean, this has been a long process for them. How are they handling all this pressure right now?
Our nurses are very tired. They are, again, strained. They're worried for our community. They are also frustrated. They know that the vaccination works. Those who are vaccinated stay with us upwards of 6 to 9 days. And again, those who are unvaccinated average about 4 weeks. So, our nursing staff and our medical staff, they're frustrated, they're tired, and maybe even heartbroken, because now COVID is affecting, again, those who are having non-COVID related issues such as heart attacks, strokes, and traumas. And so, this is affecting everyone, and that is our plea to the community. It's to please get vaccinated so, our healthcare system can handle the patients when they come to us, when they need us, and we will be ready and willing and caring and concerned as possible as we can, because we want to take the best care of our patients. So the more people get vaccinated, the better it is for everyone and who come to the healthcare system seeking care.
Yeah, and Jason, same question for you. Just the impact that this is having on all of those who are taking care of these people who are ill and seeing these numbers on the rise, it has to be discouraging at times. I know that there are medical professionals who are so dedicated to our community and have done so much, but if you could speak to what the staff is going through right now.
Yeah, thank you. I think that it's, really challenging. Elena said it really well, that the staff are, really upbeat about, the challenge ahead of them. The patients, recognize that, they're still compassionate and caring, but they are tired. And there is a level of frustration when you know that the patient that you're caring for, especially the COVID patient you're caring for, was not vaccinated, and it was largely preventable. And then I think on the other side, you have caregivers that are, again, frustrated because you weren't able to care for. We knew that we were on diversion, and we weren't able to transfer that patient that we could probably help provide a better outcome for. So I think it's a mixed bag, depending on who you ask and the current day of the week and the status that we're in. But I just want to thank all the healthcare workers out there that are on the front line. All of them, inside of our organization and outside, are working tirelessly. And we're hopeful that this wave is, close to an end, but we don't think it's going to be, we don't think it's going to end unless there's some social interventions that all of us, collectively take.
Jason Chang of the Queen's Medical Center, and of course, Elena Cabatu of Hilo Medical Center. We really appreciate your time this morning. Thank you so much for all that you and the people in your organizations are doing for our community. Thank you for spending this time with us.
Thank
you. Aloha.
Well, Ryan, if that's not a wake-up call, I don't know what is. Both of those facilities saying that their ICUs are at capacity, that they are finding other places in the hospital. You heard Elena there saying that they have people in the maternity ward who normally, they're taking care of mothers and babies, and they're taking care of COVID patients there. In her hospital, some of those long haulers up to 100 days in a bed there. And, on the average of 4 weeks at Queens, they're looking closer to 2 weeks. But, a typical person who's in a car accident or what have you, they're saying around 4 to 5 days. And in this case, those 14 days, that's a huge difference. The 23rd cannot come fast enough. That's when more healthcare workers are coming to our state. But in the meantime, they are urging everyone to get vaccinated. And he said, be careful, limit your risky activities, because you could be facing a backlog yourself if you need emergency care.
And I think the other alarming statistic or message that came out of this was just the foreshadowing of what is to come. I mean, we look and we hear of these numbers right now that both these hospitals are currently under, and the capacity issues that they're having. But recognizing, as Jason was saying, that some of these larger numbers, these 700 case numbers, these days where we have 500, the hospitals might not really see the impact of those types of numbers until 2 to 3 weeks down the line. And they are anticipating that those numbers of people that will need to be seek medical attention in the hospital facility will also increase. And combining that with what they're seeing just with trauma patients and other types of injuries and ailments that are coming in through the hospital is really pushing them to the limit.
Yeah, and you heard Jason also talk about the efficacy of the vaccine, that yes, they do see a handful of patients there that have a breakthrough case. However, those outcomes, they tend to be better. Those people tend to recover faster. And most of them tend not to come to the hospital in the first place. So that is another argument. There are some people who say, well, you can get COVID even if you get the vaccine. That could be true in a very low percentage, but your ability to fight the infection is really, increased with the help of the vaccine.
Yeah, just alarming statistics and a message that I think everyone needs to hear. We encourage you to share this video and make sure to go back and watch the entirety if you came in a little late. But it's very great to hear, a great message, I should say, to hear from these individuals who are representing 2 hospitals in our community, in our state, that are trying to do all that they can to keep everyone safe. So we thank them for being a part of the show this morning. Looking forward to more conversations this week, including checking up with the Department of Labor and Industrial Relations. We'll be talking to Director Ann Poroyo-Stockwheel about the unemployment benefits. We know that they will, or they had just recently opened up, or plan to, open up the in-person appointments. So we want to get an update on from her on all of that, and talk to the Lieutenant Governor, who was previously scheduled for today, but was actually on call this weekend at the hospital where he also serves, and so he will be joining us on Friday.
Yeah, that again is a reminder of just the needs of our community. He was called to be in the emergency department because, again, they are seeing this influx of patients. So he was kind enough to reschedule to Friday. We are going to talk to him on Friday. As you mentioned, we'll talk to Anne on Wednesday. A lot of you may have questions about unemployment benefits, which are sunsetting. That $300 plus up is ending. And so what does that mean for the benefits that you're currently getting? And what about those folks who have backlogs and what have you? We'll discuss all of that with her on Wednesday. Until then, please do stay safe out there. If you know someone who has not been vaccinated yet, perhaps give them a call and a nudge. Have them watch this video. They can hear from the front lines right there about the impact that the unvaccinated population is now having on our hospital system.
We'll take care. We'll see you right back here on Wednesday. Aloha.
Aloha.
This episode of Spotlight Hawaii was brought to you by Chaminade University.